Dr. Gerace.
Thank you. I'm here today to share my experience as a Whitman Walker clinic volunteer from 2004 to 2008. For almost 4 years, I was a volunteer physician staffing the Thursday night Gay Men's Health and Wellness Clinic. As we've noted earlier today, that Whitman Walker Clinic actually grew out of that particular program, then called the Gay Men's VD Clinic, some 3 decades ago. During my 4 years as a volunteer, I was at the Thursday session of Gay Men's Health and Wellness every Thursday that the clinic was open, with the exception of 3 evenings. During that time, I logged well over 1,000 patient visits. I would say that until the clinic's previous medical director was abruptly fired in 2006, my experience as a Whitman Walker volunteer physician was an excellent one. During my first 2 years, the Gay Men's Health and Wellness Clinic was well staffed by 2 to 3 physicians on a given night, and it was a collegial atmosphere conducive to both patient care and physician learning. Unfortunately, once the medical director was fired, this excellent clinic program dedicated specifically to serving the needs of gay and bisexual men gradually decayed due to neglect from the current clinic management. I find it very interesting that no one from Arnold & Porter contacted me to interview me about my experiences during this difficult time, in spite of my 4 years of service. In my final 6 months of the clinic, due to what I view as a total breakdown in the clinic's management and oversight of the Gay Men's Health and Wellness Clinic, I was oftentimes the only physician staffing the crowded Thursday night session. Lab tests were not being performed or reported in a timely manner. We were short of critical testing supplies and medications, and we were saddled with a cumbersome and inefficient new computerized charting system. Patients were frustrated by disorganization, inefficiency, and long waits. And to make matters somewhat worse, with the incorporation of the Washington Free Clinic, what had been a safe and anonymous space for gay and bisexual men to come for confidential testing and treatment had been transformed into the typical waiting room at a community health center. One only had to walk into Gay Men's Health and Wellness to find the waiting room now populated with women and, until recently, young children, sitting side by side with gay and transgendered clients waiting for confidential HIV and STD testing and treatment. Due to a complete lack of sensitivity on the part of the clinic management, what used to be a safe and confidential space for gay and bisexual men to seek medical treatment no longer existed. Most unfortunately, during my 4 years at Whitman Walker, I never had the opportunity to meet Mr. Blanchard or former Chairman Sandman, or to meet any of the other board of directors while working at the Gay Men's Health and Wellness Clinic. I wasn't actually even introduced to the new medical director until I finally requested a meeting with him 3 months into his tenure at the clinic. In retrospect, I do wish that the board and Mr. Blanchard had chosen to spend some time in Gay Men's Health and Wellness observing how care was delivered in that particular setting, and then perhaps they might have seen how some of their decisions were adversely affecting patient care. It probably would have been an eye-opening experience if board members had been present one Thursday in February of 2008 when I left the clinic at 11 p.m. because I had to see 20 patients on my own, because no second physician had been scheduled by the clinic management and the nurse manager had called in sick. And further, the newly adopted but ill-conceived computer charting system was not functioning, making completing patient charts almost impossible, and thus extending what should have been a 3-hour shift to an 11 p.m. exit for me. As I left the building alongside the security guard that night, I remember thinking they really don't pay me enough to volunteer here. That would soon change. My volunteer service ended abruptly on May 14, 2008, when I was summoned to the new medical director's office and told by him that the clinic's credentialing committee, whom I had never met with, had recently reviewed my credentials, and that although I had a valid DC medical license and carried and paid for at my own expense my Whitman Walker Clinic mandated malpractice insurance, and even though I'd been practicing at Whitman Walker for nearly 4 years, my credentials suddenly no longer were sufficient to continue volunteering at Whitman Walker. You can imagine my surprise by being fired from volunteering by a medical director who had never volunteered at the Gay Men's and Health and Wellness Clinic or never bothered to observe me at work there. There was no thank you for 4 years of service or even an attempt to find another use for me as a volunteer within Whitman Walker organization. My follow-up emails to the current medical director were completely ignored. I was simply told that I could not practice at Whitman Walker any longer. In light of the great need of Whitman Walker for skilled volunteers and the epidemic rate of sexually transmitted diseases in Washington, D.C., one has to ask why the clinic management would choose to dispose of me so swiftly and completely. While I never expected thanks from the clinic management for my service there, the truly disrespectful and classless way that I was dismissed speaks volumes of those who orchestrated my dismissal. Nearly a year later, they haven't filled my spot, and the community suffers from not having a competent licensed health provider volunteering at the clinic. I believe that my dismissal took place as a result of an email that I sent a few weeks earlier to the new medical director, in which I identified some serious problems that had developed during the long period we went without a medical director overseeing the Gay Men's Health and Wellness Clinic. As it had been a few months since the new medical director had been hired and he had not yet paid a visit to the Thursday night clinic, I decided I needed to reach out to him to make him aware of some serious problems. In my email, I respectfully asked for the new medical director's help in finding solutions to what I viewed as some serious issues of malpractice. I've submitted a copy of this original email with my testimony. Apparently, my critique was not well received because not only did nothing change in response to my email, but 3 weeks later, I was asked to leave. As I originally wrote to the new medical director, the point at which I noted a decline in clinical services was after Mr. Blincham's firing of the clinic's well-respected medical director in 2006. From that time until the winter of 2008, the clinic was without a medical director. While I cannot testify to the effect that had at daytime operations, I can say that it meant that the evening gay men's health and wellness clinic was left without any organizing force, chain of command, or quality control. During that time, we also lost 4 excellent volunteer physicians. I believe at the time of my departure, the gay men's health and wellness clinic had been seriously neglected and under the current CEO and by extension, the medical director. Under the previous medical director and CEOs, the Women Walkers Gay Men's Health and Wellness Clinic provided services unique in the area and sometimes in the country for gay men's health. At the time I was dismissed, I identified several areas of concern. Number one, and these are specifically medically related services that we were no longer providing. The recommended anal pap smears and endoscopy for detection of HPV-induced rectal cancer had been discontinued. And on-site rapid syphilis testing had been discontinued in the midst of a syphilis epidemic in the city. Pooling of collected blood samples for acute HIV detection had been discontinued. Pooling, for those of you who don't know, is a method of early HIV detection that picks up cases missed by our rapid HIV test. This routine lab, while we were doing it, picked up greater than 15 numbers of early HIV infections, and aggressive partner notification of those clients who are at that time the most infectious with HIV prevented HIV transmission to untold numbers of partners. Our on-site nuclear acid amplification test processing of oral, rectal, and gonorrhea chlamydia had been discontinued, which resulted in slower times in between testing and eventual treatment. And also, the CDC recommended urine NATS test is they recommend be done on asymptomatic clients are not being done anymore. At the time I was asked to leave, the current medical director was not involved. He may be now in the management of that clinic. But prior to that time, the previous medical director had been the chief of that clinic, and there were, like I mentioned before, 2 to 3 regular physician staffing. One other concern was that during this time, Women Walkers lost its status as one of the CDC's 9 MSM prevalence study participants.
Doctor, if I could ask you to summarize.
Yep.
Thank you.
We're at the end. There's no question that I personally feel that I wasn't treated well by the clinic, but in the scheme of things, that's not important. All I lost was a volunteer position and the $7,000 I paid for malpractice insurance. What does matter is that the current vision doesn't reflect the needs of the gay and bisexual community. And what I would hope would come from this meeting is that the current clinic board and management team would refocus its efforts to rededicate to the GLBT community. Thank you.
Thank you, Doctor.
You were dismissed as a volunteer on the basis that you did not have the correct credentials or proper credentials?
Correct. That's what I was told.
What in your, it sounds like are you licensed to practice medicine in the District of Columbia?
I am, yes. I don't.
And you purchased your own malpractice insurance?
At the instruction of Whitman Walker. And
is that a policy now that volunteers purchase their own?
No. And the credentials that I lack that they would have liked me to have had is a residency specialty training. Okay. Is residency specialty training, which would be another 2 years of training. That's not a requirement to practice medicine in the District of Columbia. Okay.
You know, and since you have been gone, there has been no position. There's been no one filling this position on this.
The one other physician who was covering that clinic now is now doing double duty. I would say that I had a former patient call me because the OBGYN who was hired for lesbian services very kindly volunteered to fill in a spot at the Gay Men's Health and Wellness Clinic. But the patient called me because they had been prescribed a medication that treats the organism Trichomonas, which basically gay men don't get. To make a long story short, and he was concerned what this medication was, and that his partner had also been treated with something with the same medicine.